You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, full mouth reconstruction. According to my first guest, he says your teeth are never too bad to have the smile you've always wanted. We're talking about dental implants today, and we're talking about what he calls full mouth reconstruction. He is Chicago's go-to implant dentist, Dr. Petrungaro. Dr. Petrungaro, welcome to the program.
Thank you for having me. It's my pleasure.
Now, before we get into today's topic, and you brought a lot of photos, probably, and we were saying this, I can't even use all the photos, the before and after photos you brought. So we'll try to get to as many of those as possible. Now, for those of you that don't know your Chicago practice, I mean, who's the typical dental implant patient you see?
Well, you know, we have patients from a wide variety of treatments, sometimes from as early as their late teens, all the way up into their late years. But our typical patient is going to be the patient that is bad breath, teeth moving, pain, gum disease, and they're going into possibly losing teeth, and they're coming to us for new teeth, or denture wearers, people that are wearing dentures that are looking for something a little bit more stable.
You don't believe anybody should be wearing a denture, basically?
In today's day and age, absolutely not. Absolutely not.
They're a thing of the past? You think like the future of dentistry, everybody will have teeth supported by implants? Do you believe that?
Where we are now in our field with technology, with the advancements of technology, and the ability to deliver a wide variety of options for patients, there is no reason any patient in today's day and age should be with dentures.
And you do this every day?
Every day. Every day. Sometimes 2 to 3 times a day.
So where you are, I mean, are there a lot of people either headed to dentures or wearing dentures where you are?
Randy, we could take the 4 stadiums in Chicago, Wrigley Field, Soldier Field, U.S. Cellular Field, and United Center. And we could fill all of those stadiums up with people to capacity 10 times over. That's how many people in the Chicagoland area that are in the process of either losing teeth, having problems, or wearing dentures. Absolutely.
So if dental implants are so good, and we've talked a little bit about this, I mean, what's your take though? Why aren't they all doing it?
I think there's a lot of reasons, okay? First of all, patients just don't get the information. They go to their dentist, they're going in, and they're not just being told about some options for them. And that could be the dentist's own expertise with doing them. Maybe they're not comfortable with them. Okay. The other reason is a lot of patients don't know how serious some of their problems are. I mean, they know they've got some problems, but they may not know how bad their disease with their gums are, or their cavities or broken down root canals could be. And this is another problem. And and then another thing that I really think about it is that because we have a wide variety of patients who come in. Some people don't have any teeth. Some people are in the process of losing their teeth. And a lot of people fear dental pain. And they fear, oh boy, I've got to go do something else. And maybe it's going to hurt too much, or maybe I can't, I can't afford it. Or there's a lot of reasons that they can come up with in their mind. But really, where we're at today, I mean, this is so well performed now at a level. Okay, and I could speak for our practices that we take patients from all different walks of life and we help them realize what their new life could be like. Because because people don't want to smile sometimes. You see people and you look frumpy and this or that, and I see them come in for the consults, and we start talking about things, and then they have the surgery done. Then 2 days later they're getting their new teeth, and it's emotional. I cry. I mean, if you go to our website and you see videos with patients, you'll see me with a tear in my eye, because still today it's emotional for me because I love doing it for people, and they deserve it. Why in today's day and age with all we have available to ourselves, wouldn't you want to put your smile back? But there's so much more that goes with just a smile. There's chewing, there's digestion of your food, there's interaction with your spouse or your significant other, there's kissing, there's looking, smiling. I mean, there's just I can't even get into how many reasons why people should do this. And you know what? It's amazing. I'm still amazed. I've been doing this a long time. Okay, and I'm still amazed the joy that we can give people when they see what can be realized, and they see the level that it can be realized at. It's amazing.
If somebody's watching this, correct me if I'm wrong.
I will.
If everything works out, somebody watching this, no teeth. Or maybe they have teeth that are just literally falling out of their mouth.
Yes.
The day after tomorrow, they could have a brand new upper and lower teeth that don't come out, that are permanent.
100%.
Really?
Yes.
Is that rare?
It's unique, and we are on the cutting edge of this technology in the Chicago area.
To do it that fast.
To do it that fast. But remember, speed's not the issue. Okay. It's great and it's wonderful, but speed without the level of quality of care doesn't translate to success. What we're doing is we're taking years of doing these procedures, the way they're being done all over the country and the world right now, and we're increasing the technology and how we deliver it, and we're changing the materials that are more realistic to your natural tooth that some of these procedures are being done. And with where we're at with our technology right now, it's so amazing what we can do with digital transformations. And it's just incredible.
You told me what used to take you 10 months, you can now do in 2 days.
Well, absolutely. It's amazing where we've developed, and with our technological advances and what we do in our practice, it's amazing. This is why I brought so many befores and afters.
Show me some of these before and afters, and then we got to move into the full mouth reconstruction.
Okay. Look at Jeannie. Look at her picture where she's got like the lines on her face and it's drawn, and her upper lip looks like it's sunken in.
Okay.
Now, Jeannie's an attractive woman. She just wants to get back to smiling and being whole.
So she has no teeth.
She has no teeth. Okay. So what we're able to do for Jeannie now in those 2 days is we're able to take Jeannie where her lines on her face are here, her lip is sunken in, and her whole face kind of looks a little drowny, and just change it immediately. Okay, so she can now realize we're literally doing plastic surgical procedures with the way we're placing the implants and positioning the teeth, where we're filling up all these lines. We're now, it would be a dermal filler of some sort, but now just by positioning Jeannie in the right direction where her implants are and doing it that quickly, gets rid of all those negative creases and in the age.
So this is done, like you can go in on a Monday and on Wednesday you get your new teeth.
Absolutely.
Okay, so this after, it is dramatic.
Dramatic. It's amazing. She's so happy because now she goes, Paul, I just want to get down to Florida. She had lost her spouse, and this is what she was doing for herself. And it's amazing. And I'm so happy we were able to do it.
How soon can they eat?
Randy, they can eat that night they get them in. We tell them to take a little easy because you want to start to train everything again and easily put on when you go to the orthopedic surgeon and have your knee. They don't tell you to go run a marathon, but you start to walk slowly. Same thing.
Okay.
But you're chewing and eating that night. You're
all right.
Eating softer foods, broiled chicken, broiled whitefish, whatever you like. And you're increasing it over time. Just like you would be doing with your knee or
But
your
when it's
hip.
all healed up, you can literally eat whatever you want.
Anything you want. Anything you
And
want.
do they? And do they call you and say,
we have a lot of people call us telling they gained 15, 20 pounds. So we're not going to do this for weight loss, but we're going to do this to help them enjoy their life. Here's another one of our patients. Right. Beautiful woman. She came in, she had options, going to a full denture, going to implants. And what she chose is based on her age and her youthfulness and where she wants to be with her future. She chose implants. So she was able to have these in 2 days. And it's a total face transformation. I mean, she's a beautiful woman, but look at her now. Look at where she's at. Look at how the teeth.
Wow. I mean, that's a big one. This is a big one.
But look at how the teeth fit her facial profile. They're softer curves. You know, we treat people, everybody's individuals in our practice. There's no cookie cutter approach here. But to have the teeth be able to be designed to match her facial smile, her cheekbones, the middle of her face, and how it's softened in the curves, amazing. I'm so happy for her because now she's going to enjoy the rest of her life. She's going to smile and be able to have interactions with people and never hold back. You know, a lot of people don't want to smile. They hold back. They have a partial, they have a denture. They're afraid to like show their teeth. What's the first thing? All kinds of studies have been done. One of the first things you ever notice about people, they tell you, is their smile.
Yeah.
It's how you and I interact right now. We have our clothes on. Nobody knows. God, we don't want to know what I've got underneath my jacket. But I mean, you know, people smile. They want to interact with other people. It tells you I'm open to being receptive, or it tells me I'm closed off. I don't want to talk. That's my opinion.
What do they like more? Like when you do this full mouth reconstruction, what do they like more? The way it looks or what they can eat?
It's both. It's both. Some people come in because they just want to chew again. And they get the benefit of how it looks. And some people like, listen, I just want to look good. I don't care what it is. And then I can't believe I can enjoy my life and eat this kind of stuff. So they're kind of both ways back and forth. But these are the benefits. And then there's all things that they don't even realize what they're going to enjoy yet until they start to do it. Okay? So it's really an amazing thing.
How old can you be to get this done?
The oldest person that I've ever done implants on was a 97-year-old female.
Why would a 97-year-old want to do this?
Because if you're lucky enough to be 97 years old, why not live the next 25 or 30 years of your life enjoying what you eat and how you look and you smile? You know, today's day and age, the longevity of life is getting longer for everybody. We're going to be, this is a part of our field that's growing because it's the way to go. And as we're learning more about this, as people live longer and longer, more and more people are going to be having single implants, multiple implants, full mouth implants. It's a fact of where we're at. And I think it's so amazing that we can do this for people. And I love that we do this in Chicago for people. And I love that we deliver it the way we deliver it. I'm so proud of what we're doing. I think it's fantastic.
Okay, good. Now, your center, we should mention.
Yes.
I guess how some of these procedures are done is you go to one place for the surgery, another place where they put the teeth on top, maybe a prosthodontist or something, another place for the imaging. You do it all right there.
We do everything in-house. We have the prosthodontist in-house, we have the lab in-house, we have the milling machines in-house, we have everything in order to treat patients when they come to see us. We still have doctors that send us patients that we work back and forth with, but a lot of them want to use our center and our facility and how we do it. So yes, we take care of patients entirely. No one comes to see us for treatment and leaves without a set of fixed teeth.
When you see like pictures like this, for example,
yes,
because you've been doing this a long time.
Yes, long time.
Do you ever, like you're hearing their hard luck story,
Yes.
but do you ever get excited going, boy, this is going to be a good one?
You know, for me, I do, because I know what we're going to do for them. For them, I'm so excited for them because, you know, there's a little uncertain with this. They don't always know what's going to be the result. They're trusting us, they're trusting in me. But I'll tell you, when they see this and the emotion and the reaction, it's unbelievable. Okay, unbelievable. We have the grandmother comes in with her grandkids. We have the woman who's never had showed her husband that she has dentures. Okay, so he's never seen her without them. And to be able to do this where they don't have to go a period of time is amazing, because it's like they don't miss a beat to being able to get back to their normal life, which is really cool.
Now, for the people, and we're talking about full mouth makeovers, like extreme full mouth makeovers today. So a person that's not quite ready for a full mouth of extractions, but they need a combination of procedures like a few implants, maybe crowns, bridges, veneers, whatever. This is all that you do.
Yes. And the beauty of how we do it, let's just say somebody is not to the full reconstruction yet, but they know there's some problems. So the way that we diagnose and treatment implant patients, there's always like another avenue we can go to. So let's just say somebody comes in, they can keep their front teeth for years, but they're losing their back ones. No problem. The way we set the case up is we'll build the back so that if anything ever happens to the front, we're going to keep using the back and just augment what we did in the front. And this is really unique because a lot of times changes happen to patients when they're losing their teeth. But we can keep things stable for a long time, and then should they ever need to build into the front part, it's easy for us to do because we've already established where the patients are going to be.
So a lot of people, like, they seem to like lose their back teeth first.
Yes. More common, yes.
But they don't touch them, right? Because you can't see them.
Yes.
So if somebody's watching this and they're missing teeth in the back, why do it?
Because your mouth does two things. Your front teeth are for biting and tearing. The back teeth are for meshing and grinding. So what happens is when you lose that function in the back teeth, everything gets thrown to the front, and the front teeth don't have the same structural stability in the bone as the back teeth do.
Okay.
So it actually causes further tooth loss and collapse of the face and collapse of the lines on the face. So if you can stabilize where it's missing in the back and let those things be able to be how they're supposed to be functioning, you actually prolong the front. Okay. So a lot of times people don't think about, oh, I don't see the tooth in the back, forget about it, we're not going to replace it.
But they're headed for tooth, like
they're
dentures.
headed for tooth loss. They're headed.
Like if you have missing teeth in the back, you're probably going to end up in a denture.
Yes. At some point in time, because your mouth and your teeth are just intended to do certain things, and when we ask certain teeth to do things that they're not supposed to and function, your mouth is a machine. So as that machine is working, imagine any other machine. If you start missing parts of the entire process, sooner or later the machine's going to give out.
Yeah, but what about people that, like, because they're in their 80s or whatever, and they've lost a lot of bone?
Yes.
They can't do
no,
like
see, that's kind of a misnomer, because that really is going to depend on the expertise of the clinicians performing those procedures.
Okay.
Because some of these procedures are more highly specialized. Some of these procedures require certain types of implant designs and things that we do. But that's where you really have to be with the people that understand what they're doing.
So this is not a bone thing. Do you ever have to turn people away because of that?
Absolutely not. We get people that are told they can't have implants because they don't have enough bone. Okay. And then they come and see us, and there's a myriad of options that we do for patients. So there is no patient that can come into our practice and facility that cannot be managed, no matter what the situation is. And this is one of the things that we pride ourselves on, because we've done so much with research and development of products and procedures and how we do things. It's really amazing.
You publish articles.
Yes, I have.
Right? I mean,
yes.
Lots of articles on how to do things in implant dentistry.
Yes, in peer-reviewed journals.
Does it cost more to go to a guy like you?
No.
I mean, kind of known all over the country.
Here's what's so amazing. Because of the way we do things and how we decrease the amount of visits for patients, it's actually less than most of the big guys. And we're not cookie cutter. I mean, we do customized treatments. So we're less expensive than people that do things different than we do it, and we're more. We do the treatment quicker. We do it more aesthetic and less traumatic. And by the way, we do it, and we're not as expensive. Now, so it's amazing.
We're going to take a quick break. We come back a little bit more about the process.
Fantastic.
Okay, you're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We'll be right back.
My husband and I went for our initial visit, and X-rays were taken, and we both sat there waiting for the X to fall and Dr. Paul to tell us that there was nothing he could do, and he just looked straight at me and said, "Oh yeah, no problem, piece of cake." My husband and I burst into tears in his office because it had been such a long journey with my teeth falling out. Got my new teeth, and I'm gonna smile right now so you can see how great they are. Hi everyone. I would recommend him to anybody with any kind of failing teeth issues because there is nobody else that can help the way he can.
My problem is it was probably with other people who start losing their teeth on their own. The tooth was just falling out because I was losing bones around my gums or in the gums. I don't know how properly to say that. But the amazing stuff, what happened to me is 72 hours later, I have my beautiful smile. How do you like that, huh? You can have a beautiful smile, your teeth in 72 hours. It's amazing.
And you're 2 weeks after the surgery now.
Yeah, and I'm 2.5 weeks after the surgery. I'm pretty much eating, I would say 70% of what I can eat right now.
I haven't seen my teeth like this in about 15 years. From day one meeting Dr. Paul, phenomenal man, which made me go through to go ahead and do this. It's been probably a good 20 years since I've had good teeth in my mouth. Just my smile says everything, you know?
I work in an office, so I was embarrassed about my teeth. I didn't laugh a lot.
We came here from Michigan to get beautiful smiles.
Then 2 days later, we got our teeth. They fit great. I opened up at work. I like to joke now, and I'm not afraid to laugh.
Now I can smile, and it's a big difference in how you feel when you can actually smile again without covering your mouth or trying to make your lip cover your mouth. You know, it's a huge difference.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, full mouth reconstruction. According to my first guest, he says that your teeth are never too bad to have the smile you've always wanted. Teeth and gums, I guess.
Correct, yes.
So welcome back to the program.
Thank you.
You brought some photos.
Yes.
So what are we looking at here?
So let's look at Tom. Here's another individual came to see us. Yeah, he was having some issues with broken down teeth and loss of the dimensions between his jaws. And some of the teeth were still in pretty good shape. So what we were able to do is a combination procedure for Tom where he had the teeth that were to be removed. We rebuilt around him, and he had his beautiful result in 2 days.
Looks different. Looks good.
Yeah, it helps to really change people's, their how they feel about themselves. We just saw him not too long ago for a maintenance visit, and we were talking. I said, "How's it going? Tell me what's happening." He goes, "Paul," he goes, "I can't believe it." He goes, "I can't believe." I was a little skeptical in the beginning. He goes, because I talked to some other people, and they were telling me, this takes 6 months or 5 months. He goes, but it was the best decision I've ever made. I said, "Well, we're really happy that you chose to be with us, and it's amazing. It's just amazing." Here's Claudio.
All right.
Claudio is Italian guy. Okay, he's used to, really used to eating certain types of food like us Italians do, depending on how I was raised. I was raised on stuff that was all homemade and sausage hanging in the garage, the whole story.
Okay.
Claudio comes in, he had his upper teeth and he likes to eat things, like to bite into things. But when he would do that, he would feel the whole top front move. Came in, we had a discussion about what could be done, and we discussed with him. So in his upper, we were able to fix that problem, get him back on his feet and back out to eating supersonic capocola in 2 days.
That's very nice. So somebody watching this, day after tomorrow, they get a brand new set of teeth.
Yes.
And you do that all the time.
All the time. We have the technology. We have the know-how in the technology, and we do it all the time.
Okay.
And if I can interrupt.
Okay.
One of the things that really has led me and my practice to get to this level is for over 20 years, we've been publishing clinical papers in peer-reviewed journals on immediately restoring not only single implants, but many implants with provisionals and final crowns very quickly. So this is not anything that's brand new. It's been around. It's just that our field and the way the field moves is a little slower than sometimes things can be done. So what we've been able to do is for many years and publish it in peer-reviewed journals, the success rates. I have the only paper that's 15 years and 5,000 implants on doing individual teeth and multiple teeth and provision and success rates.
So if you're only missing one tooth, why an implant over a bridge?
Okay.
Help me get that.
So simple. Number one, bridges don't do anything to support the underlying bone or the gum tissue. Okay? So if you can do a single implant, number two, usually doing a bridge, you have to cut down the teeth, so damage your natural teeth, to hold the two parts of the teeth so there's one in the middle, which would be the fake one.
Okay.
So now you're damaging healthy tooth structure. Okay. More importantly, when you look at the dollar cost average long term, most people come in and say, I need a bridge, I have dental insurance. So, dental insurance pays for a new bridge every 3 to 5 years.
Okay.
This is what the rates are. Now, what does that tell you about a bridge? Most bridges don't last. They don't last because insurance companies don't want to pay for anything.
It's like a patchwork.
Like a patchwork. Whereas you're doing an implant, if it's done the right way, we guarantee our implants in Chicago in writing.
So just give them the tooth back rather than
Give them tooth back.
than a bridge.
Plus, you're making the bone on either side of those teeth be supported with the implant, and you're allowing the gum tissue to be full. Now, this may all be a little simple for people, but hey, when you're smiling and you have a high lip line and you need an implant in that front tooth, you're going to know right away if it's fake, bridge, or an implant. Well, they will know implant, but a tooth. And that's a big deal for a lot of people. Remember, what I tell all my patients, and I tell doctors when I train them, listen, whatever you're going to do to that patient, remember, for the next 50, 60 years of their lives, every day you get up, they're going to look in that mirror and they're going to see that what was done. And that's the mark that we have for people. We're helping them to put back what they've lost or they need to have fixed or changed, and they're going to smile for the rest of their life. We owe it to them to do that the right way. Another patient, Dominic.
All right.
Dominic, great guy, comes in on a Monday morning. He had been other places for consults. He comes in, he goes, I'm coming to you because I had to hear about this immediacy thing. I said, fine, no problem. By the end of the consultation, he booked, because we had a cancellation for Wednesday morning, got his teeth on Friday, and he cried. His testimonials on our website. And I just saw him last week. He came in and we talked. He gave me a hug because, Italian people are usually a little more gregarious.
Okay.
And I said, how's it going? He goes, you know what? And I had a young individual I was going to be bringing into the practice to join our staff. And I asked him, Dominic, please tell him what your experience was. He goes, I was worried about this. I went other places. And he goes, I didn't know what to expect. But he goes, it was the most amazing thing in my life. And, our patients become our family in our practice. They're with us. Like I said, he's now happy. He loves it. And it's so nice to see these people.
It looks natural. And respectfully, I have to say, you're a dentist, you're a specialist, a periodontist, and you probably think the teeth are the most important thing, but it is just teeth.
Well, Randy, that's easy for you to say because you got a great smile. Your teeth are good, okay?
Thanks.
There's a lot of people that don't. There's a lot of people that are afraid to smile. And they walk around like this, or they'll come in a consultation, or you'll see them and they're looking down all the time. This is a way of life. This is how we express ourselves, how we interact with our significant others, how we interact the first time somebody meets us or we go. That's just not true. It's not just your teeth.
We talked about the movies, right? If you want to make somebody look poor, if you want to make them look like a street person, you give them bad teeth.
Yeah. Yes.
In the movies.
Well, there's a whole reason why in the restorative aspect of what we do, like the prosthodontists and dentists do, there's a shade for how you make your teeth look called Hollywood white.
Okay.
Well, because everybody wants that beautiful smile. That's so to me, your smile says everything about you. It invites people to interact with you. It invites people to think.
When you do these full mouth reconstructions, do you find that their personality changes? Like they smile more?
They come in, they've got makeup on for the women. The guys come in, they're not wearing the hats down over their head anymore. They smiled. We've got, with all the patients we've got befores and afters, we've got people that went out and changed their hairstyle, dyed their hair after.
You say they want to hug you sometimes.
That's an Italian, part of the family kind of thing. So, but our patients become our friends and they become our family, and we keep our beautiful relationship with them, with doctor-patient, but we also realize that we're treating human beings and we're treating patients.
So if a person's watching this, they have bleeding gums, bad breath, loose teeth, they have gum disease, but they're not quite ready for a full mouth of teeth. If they come to you, you may do a combination of like implants, bridges, whatever.
Absolutely.
Veneers. You do all that stuff.
We are not cookie cutter. Okay, so we pride ourselves when we learn about our patients, when we get our diagnostic material. We've got the newest CAT scan machines. We have all of this information we take, and we present patient options. And a lot of options for people are to keep some of their teeth. As a periodontist, my base training is to do everything we can to keep teeth as long as possible. So that's the philosophy of our practice.
We have to bring this up, and I'm sorry to interrupt here, but sedation. Mm-hmm.
Yes.
Most of these patients that get a full mouth reconstruction are getting sedation.
We want our patients to be comfortable. So what we do is we use board certified MD anesthesiologists for all of our sedation procedures, and they have options on what type of sedation.
It's just IV sedation in most cases.
Yes, it's IV sedation in most cases, yes.
Safe?
Safe. MD anesthesiology, we have all the machinery, we have all the technology, and very highly trained anesthesiologists that do that sedation, yes.
Now, you told me this on the phone. You said that some people, like their broken down mouths, they get the sedation, and they don't remember that they had it done.
Nothing. And it's amazing.
That happens sometimes?
Absolutely. In today's day and age, with all of the issues with, pain pill addiction, it's amazing how little of our patients actually even take a pain pill. And I know that may sound
Is that right?
It may sound a little bit unbelievable, but it's true. I mean, how we manage people and how we take care of them is I think a testament to what we're doing for people. Not only in a very quick way to get them back to their normal lives, but also the management of them pre-procedure, intra-procedure, and post-procedure. I think that's all very important for how their experience is with getting these procedures done. Yes. I know I've got more. Do I have time for one more?
One more.
Okay. This here is another amazing case, because when he comes in, he's seen other people for consults, comes in to see us. We give him an option that he wasn't presented, and he does it. Owns his own business, president of his own company, and he comes in now. And when I see him 2 days later,
Yeah.
he is just like, he came with his wife. He goes, he goes, Paul, this is unbelievable. Another on our website video testimonial, phenomenal situation. And I'm just so happy we do this for people over and over and over. And it's amazing technology, and I'm so happy to help people like this. It's really great.
We have to mention this because I guess Medicare, Medicaid pretty much doesn't cover this for the most
That's
part.
correct.
Even the best dental insurance covers a very small part.
Yes.
What's
We
the answer?
have many levels of financing for patients that they can make use of.
Do they finance it?
Absolutely. I would say 60 to 70% patients do their financing of it. Yes.
Oh, is that right?
Absolutely, yes.
So now there's no more excuses.
No more excuses.
You got sedation.
No more excuses. So you got comfort, you've got convenience, you've got expedited procedures, and you've got the ability to finance it over time. There's really no excuses to not do this for
So
yourself.
really, I mean, if somebody's like bleeding gums, broken down, teeth are literally loose.
Yes.
You're saying the day after tomorrow, which is a 3-day,
Yep.
they could have a brand new upper and lower teeth.
Yes, 100%.
And you do that all the time.
All the time. And we didn't even mention, you say to patients that have those problems, what that means to their overall health. There's a huge link between gum disease and bone loss in the mouth and heart disease. Okay? And there's been many studies done over
Well, it's
the
a
last...
bacterial infection,
Bacterial
right?
infection. And there's a significant correlation between heart disease and worsening of heart disease and gum disease.
So
and
can
gum
your
infection.
gums be too bad
Absolutely.
to do some of this stuff?
Well, the etiology of that is the infected tooth, tartar, plaque.
So you clean it up.
Clean it up.
So your gums are never too bad to get
Never too
maybe
bad.
an implant here, implant there.
Never too. There's a lot of misnomers where patients think they're going to need a root canal or whichever happens. So the doctor puts them on an antibiotic. The antibiotic runs its course. But the real problem is until you get rid of the etiology, the antibiotic is only masking the infection. It's reducing the amount of bacteria around. But once that runs its course, if the cause of the infection is still there, it's going to come back, and it's going to come back worse the next time because the bacteria are smart. They like to change, and they keep growing.
And they live on the tooth.
They live on a tooth. They live on the plaque
So
and
is this
tartar.
true? I mean, if you pull out an infected tooth, like a single tooth.
The etiology is now gone.
Okay.
Things will heal.
We are out of time. Final message, somebody watching this, and for whatever reason, they've heard your message.
Yes.
And they have teeth. Maybe some of them are still savable. But they're afraid for whatever reason. What do you say to them?
I'm going to say, come and talk to me, and whatever you are afraid of and whatever is the hindrance, we will get through it together.
Did
And I'll be
they
happy.
get to talk to you? Because you're a big shot, right?
I do the consults myself. So
And they
they
call
talk
you
to me.
Paul. They call you by your first name most
I
of the
get
time?
called everything, Doc, Paul, Paulie, depends if they're Paulie, But when I introduce myself to people, I say, hi, it's Paul, nice to meet you. And I'm just one of the good old boys from the south side of Chicago.
Okay, good. I want to thank you for coming on the show. Great stuff.
It's been a pleasure, and I hope to be back again.
All right.
Thanks, Randy.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.